Good day, everyone. Today we will tackle our educational pamphlet about the combined endodontic, orthodontic, and prosthodontic treatment of fractured teeth. So, first, what is collaborative care? Collaborative care in dentistry involves a team of specialists working together to provide comprehensive treatment. This approach is essential for complex cases like fractured teeth, where multiple disciplines like endodontics, orthodontics, and prosthodontics come into play. For the roles of dental specialties, first is endodontics. It is the dental specialty focused on diagnosing and treating issues related to dental pulp and surrounding tissues. When a tooth is fractured, the endodontist plays a critical role in assessing damage and determining if root canal treatment is necessary to save the tooth. Second is orthodontics. It specializes in aligning bites and straightening teeth. After an endodontic assessment, the orthodontist may be involved in repositioning teeth to ensure optimal function and aesthetics. Proper alignment can also help prevent further fractures and complications. Lastly, prosthodontics. It is dedicated to creating artificial replacements for damaged teeth and restoring oral function. Following the work of endodontists and orthodontists, prosthodontists design and fit crowns, bridges, or dentures, ensuring that the restored teeth blend seamlessly with the patient's smile. The interdisciplinary approach to dental care emphasizes the importance of a collaborative treatment plan that begins with a comprehensive assessment, where each specialist evaluates the tooth and surrounding structures to identify all issues. From this assessment, the team develops a tailored treatment plan that addresses the unique needs of the patient. Ongoing communication among specialists is crucial, allowing for regular discussions and adjustments as treatment progresses, which minimizes risks and enhances outcomes. This holistic care is especially vital for patients with complex needs or systemic health issues, as insights from different specialists can significantly impact the overall strategy. The overall treatment strategy, ensuring that all aspects of the patient's health are considered.
So, for our example scenario, we have a 10-year-old boy came to the dental clinic 20 hours after he had fallen and injured his anterior teeth. Clinical examination showed lacerations of the upper lip with moderate edema. The maxillary left central incisor had a transverse fracture of the crown, and the maxillary right central incisor and left lateral incisor also had fractures of their crowns. The apices of the central incisors were nearly completely formed. Radiographic examination verified the presence of the fracture of the maxillary left central incisor, as can be seen in the figure 1. So, for the treatment plan, the mobile crown portion was removed, as can be seen in figures 2 and 3. The remaining portion of the tooth was below the alveolar crest, seen in the figure 4. Root canal therapy was carried out immediately to the maxillary left lateral incisor. A root canal filling was performed at the maxillary left central incisor. Calcium hydroxide dressings were placed in the maxillary right central incisor and left lateral incisor, as apical root formation was not yet complete. It was decided to extrude the tooth orthodontically. A screw post was cemented to the fractured tooth, as can be seen in figure 4. Then an elastic thread was applied from the screw post to the specially designed vestibular arc of the Holly appliance for the extrusion of the tooth, as can be seen in figures 5 and 6. The patient was examined every 4 days to check and reactivate the elastic thread. The child fell down for the second time during active orthodontic treatment and fractured his maxillary left lateral incisor, which had earlier been filled with calcium hydroxide. There was clear evidence, both clinically and radiographically, of about 5 mm extrusion of the tooth, as can be seen in figure 7. Approximately 6 weeks later, the active treatment was ended. There were no complications during or after the orthodontic treatment. After completion of the extrusion, a post core was performed, as can be seen in figure 8. The tooth was successfully restored with a veneer crown constructed over the post core. The fractured incisal portion of the right central incisor was restored with a composite resin using the acid etch method. The fractured maxillary left lateral incisor was restored with a jacket crown, as can be seen in figures 9 and 10. The patient was examined 2 years after treatment, the stability of the crowns can be seen clinically and radiographically in figures 11 and 12. So, for the conclusion, the necessity for an interdisciplinary approach to treatments of routine dental problems has been recognized for a long time. In the case described, an endodontist, an orthodontist, and a prosthodontist participated in the dental management of a patient with a subgingivally fractured maxillary permanent left central incisor. It is clear that without such cooperative action, the prognosis would not have been good. In many cases, forced orthodontic eruption provides a useful alternative to extraction or extensive periodontal surgery. Adjacent teeth need not be prepared for fixed prosthesis and alveolar bone is conserved. So that's all for our educational pamphlet about an interdisciplinary treatment.